How do you think research about mental health and well-being in rural areas should be done? What should the priorities be? How should communities be involved in this process? What would make it feel fair, meaningful, and relevant? This survey has been co-designed by a group of community members with a range of lived experiences, including those with no previous involvement in research, alongside practitioners and academic researchers at the University of the Highlands and Islands. This process was designed to ensure that the questions are relevant to people with lived experience and people who live in rural parts of the Highlands and Islands. It is facilitated by Community Knowledge Matters, which is a network for community-led research across the Highlands and Islands, and is hosted by the University of the Highlands and Islands. This survey will only ask general questions about your thoughts on research on mental health and well-being in rural areas, as well as what you think generally influences people's mental health and well-being in these places. You will not be asked any questions about your own mental health and well-being. We ask you to not include any personal information that could identify you, or anything that you prefer not to be shared with others. We're keen to make this as accessible as possible. If it would be helpful to have any of this information in any other language or format, including the survey questions themselves, please get in touch with us via the link below. About this survey. We believe that anyone can do research. It doesn't only need to be carried out in universities or by academics. We decided to put together a survey to find out how you might like to engage with future mental health research in a rural context, so that it can feel fair, meaningful, and relevant to your priorities. We strongly feel that working with communities through all stages of research is essential for it to be significant and for the research to aim for tangible outcomes. This can include leading on setting the research questions and priorities around what should be researched, designing the research project itself, carrying out the research, analysing the findings, and using it to create lasting change. For example, not only have the questions in the survey been collaboratively set, the responses will also be analysed by community members alongside the academic researchers to make sure the conclusions being made from the results are understood and relatable to rural communities. The collaborative research team will write up a paper together, and the anonymised findings will be shared on the Community Knowledge Matters website. This will mean that the conclusions from the survey responses can also be shared with policymakers, funders, researchers, and health and social care professionals who may want to engage with rural communities about mental health in the future. As a result, we hope this will ensure that your feedback on how you prefer to engage with research can be better taken into consideration. Ultimately, we want to challenge what research around mental health and well-being looks like, so that it can be more inclusive and accessible to those who are most affected by it. So who are we looking for? We are interested in hearing from people aged 16 or over who currently live in rural Scotland or have lived there within the past 12 months, regardless of whether they were born or grew up there or not. This includes people living in mainland Scotland or in the Scottish Islands. If you live in any of the areas on this map that are coloured either orange, blue, red or purple, which represent mainland and small island towns or rural areas, we would love for you to complete this survey. For the purposes of this survey, we're asking people who live in areas coloured black on the map to not complete the survey, as these represent some of Scotland's larger towns and cities, such as Perth, Ayr, Greenock and Dumfries. If you have something to say about this subject, but you no longer live in a rural area of Scotland, or you live in an area you consider to be rural but that is coloured black on the map, we would still love to hear from you. So please get in touch via the link below, and we'd be happy to find other ways for you to get involved in the project. All are welcome to fill in this survey, no matter their heritage, ethnic origin, culture, age, ability, gender or sexuality. And we are particularly keen from people who may not have been involved in research like this before for any reason. We are also keen to hear from you whether you have lived in a rural area of Scotland for a month, a year or your entire life, as your experiences and thoughts about rural mental health research are significant and valuable. You may also wonder whether the survey applies to you based on your experience of mental health. We all experience good and bad mental health, so we're keen to hear from you whether you consider yourself to have a mental health diagnosis or not. You can find more information about the survey, the process of designing it collaboratively, and what we mean by the words research, rural, and mental health and well-being on the Community Knowledge Matters website via the link below. How to fill out this survey. There will be a variety of question types, including multiple choice, free text, and sliding scales. This could take around 30 minutes of your time. Anyone who completes the survey will have an option to be entered into a draw for the chance of winning one of 6 £50 local shopping vouchers. Answers will be anonymised, and any personal information given in responses will be taken out before sharing more widely. Incomplete surveys will not be included, so if you decide not to finish it, we will assume you did not want to be included in the research findings. You will be able to save the survey and come back to it, or go back and change previous answers before you submit. What's next? After this survey closes, there may be other ways to get involved in this research. To receive updates about the research project, be sent a report of the findings, hear future opportunities to get involved, or speak to a team member more about your answers, you can sign up to the specific survey mailing list at the end of this survey, or to the Community Knowledge Matters Network mailing list. You do not need to sign up for either of these mailing lists to be entered into the prize draw. The responses to the survey will be shared as an open source data to help shape future research priorities, and to also help direct support and training made available through the Community Knowledge Matters Network. Ultimately, we hope that by taking the time to complete this survey, you can help future generations feel more heard, validated and supported when they come to navigate their own mental health, or get involved in research which seeks to improve mental health in rural areas.